the Toronto Star. I'm Saba Itazaz, and this matters. It's not the first time the alarm has been sounded during the pandemic. The kids are not all right. COVID-19 has overwhelmed all of us and left everyone reeling. But data shows we don't yet know the long-term impact and consequences of what all this change and upheaval has done to our kids. A latest report by Sick Kids has revealed high rates of depression and other mental health issues in kids during the second wave of the pandemic, and they did not just bounce back as many experts had predicted earlier. As we emerge from this and as kids prepare to return to school in the fall, there are deep concerns that just going back to the old normal might not be enough to undo the harm of pandemic-related disruption. The Star's mental health reporter Nadine Yousif joins me to talk more about this latest data, what it means for long-term impacts of this pandemic on our children, and how we can try to address it. Hi Nadine, thanks for joining me again.
Oh, thank you for having me.
Nadine, give us a quick snapshot of how bad this time has been. What are experts seeing in children after more than a year of this pandemic and all that it brings, even as they prepare to go back to school?
Absolutely. So we know that the last year was tough for everyone, but especially on kids and youth in Ontario, because, we saw schools were opening and closing in correspondence with the number of COVID-19 cases throughout the year. And these disruptions were really hard for kids to get used to. Even when schools were briefly open, some kids were learning online for the entirety of the year. And so they haven't been able to see their friends in person or even get outside the house for weeks, sometimes for months. And, activities that kids used to rely on, like sports or dance, were all sort of canceled throughout the pandemic. So there was no outlet for them. And all of that is accumulating to some pretty significant mental health impacts on children and youth of all ages. There's certainly higher reported rates of depression and anxiety symptoms, but we're also seeing difficulties like hyperactivity, inattention, irritability, and other signs that generally show that kids aren't being themselves and they're really struggling.
So tell me more about the latest data from Sick Kids. Who was a part of it? What was being measured and tracked? And what are some of the numbers and findings that stood out for you?
Right. So Sick Kids is doing this ongoing study that's measuring children's mental health and well-being throughout COVID-19. About 1,500 parents and kids from all ages are involved in this ongoing survey, and all of them are from Ontario. The latest findings sort of reflect the second wave of the pandemic. So they were gathered in the months of February and March of this year. And one researcher said that the findings are very, very concerning. Overall, more than half of kids aged 8 to 12 are displaying significant depressive symptoms. And that number actually jumps to 70% among teens that were surveyed, which is a huge number. And interestingly, we're also seeing that online school is associated with higher rates of depression and anxiety. So the more time that kids are spending learning online, the higher the reported depression and anxiety symptoms are.
Right. And you're talking about some of these challenges. This has already been so tough on adults, so it's hard to imagine what this has done to kids who are still developing. Can you talk to me a little bit about the kinds of challenges that kids have been facing over the past year and a half of the pandemic, and what has been the mental impact of that? We're already talking about the online schooling. That was quite a challenge, right?
Yeah. Like I mentioned earlier, there's online school and kids have also lost a lot of activities that they used to rely on to keep them active, moving, and social outside of the home. We also know that when adults are stressed, that stress can sometimes be downloaded onto their children. So, families in general have had a hard time during the pandemic. Some lost work or a significant amount of income. And for families that were already fractured or struggling, this additional strain can make matters even worse. And for kids, because these activities and, just things that they relied on for an escape, because those things are gone, there's no escape of these harsh realities, no outlet for them to release any stress or anxiety that they may be feeling or, harboring as they see their families go through this additional stress. And schools being closed also comes with a loss of other important supports like speech therapy and even mental health and counseling services for kids. And For some children, school was a really important entry point of access to those services and often the only way for them to access those services. And so, parents are reporting that without that, their kids are worse off.
Right. And as you mentioned, the social isolation and lack of extracurricular activities with all the measures and restrictions around COVID we saw was an added stressor. And add to that the fact that I think most kids spent a lot of their time just online on their screens. Did that have an impact too?
Yeah. So, there's actually also other research that has come out specifically out of Toronto from Sick Kids and St. Michael's Hospital of kids aged up to 10, which showed that in the first wave of the pandemic, when kids were following public health guidelines, they were also going outside less and spending more time on their screens, which are all, associated with unhealthy behavior in children. And more time on screens, increases hyperactivity and irritability, and all types of struggles for children. And we also know from decades of research that being outside, playing sports, and generally being active and social is really beneficial for kids' mental health and development, as much as it is beneficial for their physical health. A lot of these things were not possible during COVID due to fear of infection spread. So a lot of kids had no choice but to retreat indoors and onto their own screens, which, like I mentioned, does have a lot of significant consequences. And so that's sort of where kids have been at for the last year and a half, I would say.
And what does the data say about how kids were faring as we saw the school year progress and we see us entering the second wave when I believe schools were reopened briefly? Did that help? Did that create any change at all?
Yeah. So, as I mentioned earlier, online school seems to have had a pretty negative impact on kids, even in the second wave. But what researchers are also noticing that when kids were learning in person for the brief time that schools were open this year, these negative symptoms of depression and anxiety did not get significantly better, which also shows us that these issues are deep-rooted. And it's going to require more than just keeping school doors open in the fall to really support kids out of this.
That's what I'm going to ask you about in detail as well. I want to talk about there were previous theories by researchers that kids are resilient and they tend to bounce back from trauma more easily than adults and they're going to be okay. Is current data changing our perception about that?
I think it is. Some researchers that I spoke to already had their doubts about this narrative of resilience. And as we look at data and as more time passes, more information comes to light, the data that we're seeing on both online schools and in-person learning over the second wave does show us that kids aren't getting used to this new normal of remote learning almost a year into the pandemic, and that these chronic stressors have been sort of going on for long enough that these struggles are becoming more significant and will require targeted intervention. Researchers are saying that we can't just expect kids to bounce back on their own. They're going to need those extracurricular activities to be fully reinstated. They're going to need those additional supports in school. And they will need schools to be fully open in the fall if we want to mitigate these challenges and prevent them from becoming even more significant.
We'll be right back. Like you said, more is needed, and you're talking about higher rates of depression and other mental health issues. And we know even before the pandemic, Ontario's mental health system was straining with more than 28,000 children and young people on waiting lists. So are experts worried that this latest crisis will only widen that gap and overwhelm the system?
Yeah, we're certainly seeing it, especially in community mental health services. What we're seeing is that generally it's been easier to go to a walk-in service, for example, or access virtual care, since that's, a new thing that's been introduced in the pandemic for a brief amount of time, like 2 or 3 sessions. And for some kids, that's enough to get them through. But for others who do have, more significant symptoms of depression and anxiety, they are going to need longer term support. And that's where we're significantly lacking. Wait lists are getting longer by months. And these services across the province are reporting, feeling very strained and unable to keep up with the heightened demand for more of those long-term counseling services. And it's not only just in the community services that we're seeing, but hospitals are also seeing a strain, which is pretty significant. At Sick Kids alone, admissions for the eating disorder program, for example, saw a 55% increase from July 2020 to March of this year. Psychiatry admissions saw a 30% increase. and emergency department mental health crisis visits, which sometimes include suicide attempts in kids, increased by 25%. And so, hospitals have been generally able to address this increase, but, there are a limited number of beds in child and youth psychiatry units. And these beds in Toronto have been consistently full in some hospitals over the course of the pandemic. And, it is worrying, and it could put a strain on the system if these things are not mitigated.
And when we look at the school year coming in the fall, are experts anticipating maybe a whole different set of issues that might come with readjusting to the old normal now after more than a year of social isolation and online learning and all of these stressors? So that comes with another set of challenges, right?
Yeah, no one really knows how kids will fare out after the summer. All of this is really new. But what we do know is that when restrictions loosened a bit last summer, the positive impact that had on children's mental health was not very significant. We were still in the middle of the pandemic, and some did still struggle. So, these Band-Aid solutions aren't enough to really address these issues that are becoming more deep-rooted. And then, what we saw over the school year, it's also become clear that these symptoms of anxiety and depression are not going away on their own. And we also know that, kids are feeling anxious about seeing their friends again after a long time or participating in activities. And they're generally feeling really withdrawn, even as things slowly reopen. It will take some time, and it depends on the kid, is what researchers said. Some kids are more resilient than others and are able to adapt quicker. In others, it will take longer. They will take their time, and they may need that additional support. And I guess what's important here, and what researchers have stressed, is that society doesn't treat kids as an afterthought as we think about pandemic recovery, and that we should really try to meet each single child where they're at and support their recovery out of this pandemic if we really truly want to address the significant toll the last year has had on young people.
Right. And did the experts speak about the long-term consequences of what kids and young people have dealt with over the past year and a half? We're basically looking at a future generation that's collectively gone through this major, unprecedented trauma that involves so many factors, right?
Yeah, the Sick Kids study, for example, itself is ongoing, and the goal moving forward is to measure how kids respond to society slowly reopening over the summer and in the fall months, hopefully as we do enter this recovery period. But we do know from previous research that it's important to address mental health concerns in children, because there's always the potential that these symptoms of depression and anxiety could follow them into adolescence and adulthood, and it could significantly hinder their development and their life trajectory. Again, it depends on each child, and each case is unique, but it's important to address these issues now while they're young, so that they don't sort of develop into more significant hindering, symptoms in the long run and into their adulthood.
So in the short term, what needs to be done now that back to school fall is around the corner? Is there anything parents and teachers should watch out for to try and address some of these problems kids might be facing?
Yeah. So, when I spoke to researchers about this, for parents, they said it's good to remain mindful and observe how your child is behaving and if their behavior is changing at all, or if they seem withdrawn or disinterested in things that used to generally bring them joy, or if they seem more anxious or concerned about things that generally did not bring them significant anxiety in the past. So it's important to, acknowledge why they're feeling this way and support them. But it's also important to understand that it's been difficult for parents because a lot of the tools in their toolbox, to help their kids have been limited due to pandemic restrictions. So this is where policymakers, including government and schools, really need to step in to ensure that the things that kids relied on in the past for their well-being do return to as full capacity as normal this upcoming fall. One of the important points that a researcher at Sick Kids has made is that pandemic restrictions, which have largely been put in place to protect adults, are having significant consequences on children. At the beginning of the pandemic, these broad restrictions were necessary because we didn't understand the virus well and how it spreads. But we've come a long way since then. And as of today, half of adults in Ontario are fully vaccinated. And we know vaccines are working effectively to prevent serious illness and death from COVID. And we also know that by September, any child over the age of 12, as well as teachers, will have had the opportunity to be fully vaccinated if they wish. And what we've also learned throughout the pandemic is that these restrictions and disruptions in schooling are really hurting our kids. And at this point in the pandemic, researchers at Sick Kids are saying, society should carefully consider these impacts when they make decisions about pandemic restrictions moving forward, because kids will not get better on their own. And, doors to school simply cannot just open. And there's a recognition that school for kids is more than just education. It is community, it is support, and it is belonging. And all of those things come not only from inside the classroom, but on the playground, on the field, and in the hallways. And it's important that come September, for researchers, kids are able to have as full of a school experience as possible so that their mental health is being taken care of for the long run.
Right. It's not just going to be back to normal. We're going to have to provide cushioning for all of these stressors of the past year and a half. Thank you so much, Nadine. You've been very insightful.
Thank you for having me. Thank you.
I was speaking to the Toronto Star's mental health reporter, Nadine Yousif. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.